Good afternoon. My name is Chad Bohorquez. I'm with Destination Home and here to share about our homelessness prevention system. I'm joined by my colleagues Ingrid and Jasmine, and we'll hear more from them in a little bit. So super grateful for your interest in our work. Destination Home, our mission is to prevent and end homelessness in Santa Clara County. We are a relatively small organization that acts as a backbone convener for a collective impact around ending and preventing homelessness in Santa Clara County. So we do very little direct services. Typically, we are bringing people together and raising funds and providing funds to direct service providers to actually implement these new strategies to kind of shift the system in new directions. I've been with the organization for about 6 years and have been through a lot. And our longest and largest initiative is our homelessness prevention system. Back in July of 2017, we kicked this off really as a way to kind of build upon the type of assistance that an HIF or a Season of Sharing or United Way were doing at that time. And to really see if we could figure out how to intervene with households who were at risk or about to become homeless, and what it would take to really wrap around each of the households and make sure they don't become homeless. So this is really kind of a build upon for the types of assistance that HIF has been providing for a long time. Next slide, please. So I'll take you through the 5-year journey. I've lived and breathed this program for a long time, so I'll try to keep it brief. And but if there's any questions that folks have or that I've skipped over any elements, I'm happy to answer that question. Next slide, please. So this is really a picture of our system today and all of the 19 partners that are involved. And there are a few other what we call referral partners that are unpaid that connect with the system on a regular basis. But really what we have is partners throughout the entire county geographically, as well as culturally competent, as well as some specific areas that we have found to be helpful over the years that we've added along the way, or have always known were essential. For example, legal services through the Law Foundation has been an essential service that we connect with. We learned early on through data, which is a priority of ours and how we make decisions, that, for example, over 30% of the households that were coming to our system were either actively fleeing or had recent history of domestic violence or human trafficking. So we early on added, for example, it's actually 5 organizations that make up the Domestic Violence Advocacy Consortium as a way to directly bring into our network organizations that can meet that need. Typically, families come and they have an immediate financial assistance need, oftentimes rent, but we can address really any financial need. So sometimes families have put all of their money toward the rent, then they can't pay for anything else, right? They can't pay for food, PG&E, car, etc. So we can also have the flexibility to provide financial assistance for any of those needs. We sit with the family, figure out what the immediate financial assistance need is, and then we work with the household over really whatever length of time that's needed, but on average, it's about 3 to 6 months, and figure out how can we get the family back to a stabilization where they can kind of exit the assistance of the household. So we do provide financial assistance over the course of multiple months, most of the time, and oftentimes tapering down over time. So as the household stabilizes or increases their income, they'll increase their portion and we'll minimize our portion of assistance during that month. And we even have families who stay with us and we provide just case management or supportive services to the household, even after the financial assistance has ended. And that's oftentimes from the request of the family themselves and saying, I still want help or support, or it would feel better if I could still be wrapped into the network. Next slide, please. So when we started, it was a 2-year pilot. We were to assist, just a little over 400 families per year. We had 7 organizations to start, plus the Law Foundation as a legal services provider. And I think what's more to note here is that overwhelmingly in the beginning, it was privately funded. So we raised a lot of funding from the Serato Foundation, Packard Foundation, Sunlight Giving, and combine that with a minimal investment from our government partners at the city of San Jose and the county of Santa Clara. And then if you go ahead and click to the next please. Now you can see where we're at today. So over 5 years, we've grown. In the current year, we're to serve at least we're gonna go over, but we're gonna serve at least 1,600 households in this current fiscal year. We have 19 network partners. You can see the budget is tipping into nearly $17 million, and this is our goal, and this is going in the right direction. You can see that now we're largely publicly funded, and the private funding has sustained, but it's really become the mechanism for how we're able to stay flexible, right? So we can um, really meet the needs of each household, remain flexible, be able to apply funds wherever it's needed around the county and not be restricted in the ways that our government funding would typically restrict us. So that's where we want to be. And actually, our goal is to actually transfer this system to the county's Office of Supportive Housing over the next year or so, and so that the homelessness prevention system becomes like an entrenched part of the supportive housing system and an institutionalized intervention in our county. Next slide, please. So here's just kind of a capsule of what all we've done in the 5 years. You know, at this point, this is back a couple months old, but over 4,500 households, nearly 13,000 individuals. So that's all, all the adults and children in all of the households. As you can see down on the bottom, majority of households are families with children, and even much more than a majority of households are households of color and extremely low income. Our mission at Destination Home is actually centered on households who are either currently homeless or extremely low income. The homelessness prevention system does allow for up to 80% of area median income, but you can see here, 87% are ELI, extremely low income. So that's 30% of the area median income, which is it's always staggering for us to think about how people survive in Santa Clara County or anywhere in the Bay Area at that level. Next slide, please. So in addition to all of that work over the last 5 years, during COVID, what you see here is above and beyond, or in addition to what was on the slide before. During COVID, we had really kind of escalating phases of assistance. As first, starting March 2020, nobody knew anything of anything, and we just kind of rallied together, started raising private funds. But the reason why we bring this into this presentation is because without that network that we had established of the 19 partners, which during COVID at some times grew to be 70 partners, we wouldn't have been able to respond or do any of that work. We already had that coordination, best practice. We had all of the infrastructure in place to put out what became our COVID response. And I think the other things to note on here, just the staggering numbers. I think that we've seen that kind of effort across the globe in different communities. But what we continue to see is that the highest area of need, so the most vulnerable people in our county, top 5 zip codes in East San Jose. So not surprisingly, but validating for what we already know, but kind of bared out during COVID as well. But I think to note is to say, like, we also put out really large amounts of money in all cities of Santa Clara County, and we were able to really kind of have a vast impact. Next slide, please. So, that's kind of like the breadth of our activities. For us, we're really data driven, really want to make sure that we're having an impact long term. So let's take a look at the impact that we were able to have on the community. So what's important to us is, that people are staying housed. That's what the whole intent of the whole initiative. So perhaps not surprisingly, but still important. Nearly 96% of households stay housed while they're receiving assistance. So this is while they're enrolled, we're providing financial assistance, we're meeting with them on a regular basis. That's kind of like what you would expect. If we weren't doing that, that would be something to indicate. But so more importantly, I think, like, after a year of what we would call like programmatically an exit, right? Like, we have officially, they're not enrolled anymore. Only 3.5% of households are showing back up in our homeless management information system, which in Santa Clara County is very robustly used by like over 100 organizations, and it's really like the shared database system. So we're not seeing people come back, enrolling in a housing program, enrolling in shelter, indicating in some way that they've become homeless. And it's not on here. There's only so much we can share, but we're just slightly, I think it's like 90.8 or something like that, but still over 90% after 2 years. We're still seeing those results. So we feel like this is a very impactful program, keeping people housed long term. We do want to be, transparent and say, like, we are not fully able to capture, like, if people move into their car and are not engaging with services, or are moving to Stockton or somewhere else, right? There are things outside of our realm as far as data collection, but we still feel very positive about the results. Next slide, please. Thank you. Um, so, you heard me mention the flexibility. So we don't have any caps on the amount of financial assistance we can provide to each household. But we do have a lot of data to show where people are landing. So throughout, all over 45 or nearly 4,500 households, on average, it's $5,600 per household that we have to put out. So a wide range of financial assistance needed. But you can see really, like, the second, third, kind of maybe getting into the fourth column is where the majority of households are landing. We do have mechanisms in place for those of you that are interested in the design of the program. We have checkpoints after $7,000 of assistance, and again at $20,000 of assistance, where there's an additional layer of review and case conferencing and bringing in other people, so we can really say, okay, we're getting to $20,000 of assistance. Like, what else could we consider? What other resources and kind of brain power can we bring to this household to figure out, like, how else we can help. Next slide, please. Reasons for assistance. So these are reported by the household. At when we enroll a family, we say, what brought you here, right? What is the main kind of like catalyst for why you are seeking assistance today? And so overwhelmingly, or I should say the largest category is related to finances. Typically, loss in income, lost job, change in hours. Sometimes, or oftentimes, there's a change in who's earning the money. So somebody may have been deported, somebody may have had a medical emergency, somebody may have left the house for a variety of different reasons, and that just changes the financial makeup of the household. And again, we're dealing with 87% of the households are extremely low income. So one little bump in the road, and you're in a situation where you need assistance, at least for a period of time. Next slide, please. Thank you. So another element or layer of the homelessness prevention system since 2017, we really wanted to be able to evaluate whether this type of intervention works. The body of research and work around homelessness prevention programs in the United States in general, especially back in 2017, was really very minimal. There was one study going on when we started in Chicago. It was a really large study. Since then, there's been more programs that have started up, but we engaged with the University of Notre Dame in Indiana's Lab for Economic Opportunities. It's a research division of the university that does research across the United States. And they have been evaluating the results of the homelessness prevention system since the beginning. They've since concluded their research. And so we are able to share kind of their results with you. They are working on publishing the results, which we should see sometime in this calendar year, we hope. It's just mostly a factor of them kind of making submissions to journals and things like that. But their research has concluded, so we just want to kind of share the top notes of that with you today. So just a little bit about the study. We didn't want a randomized control trial because we didn't really want to have to, arbitrarily say no to people. But what we do have is real resource constraints in Santa Clara County and in general, as I'm sure you know. And so we have a vulnerability assessment that we use to assess households. And the higher levels of vulnerability based on that assessment tool are the ones that become eligible for homelessness prevention system services. And so we, by that nature, by the families that qualify through that assessment and the ones that don't, we were able to create like a treatment group and a control group. And so Leo was able to track both groups. So one group received the HPS system services, and one group did not, and both were tracked through the study. Next slide, please. So you can see here on the screen the results, and in our presentations that we've given as like our community briefings, we actually had Leo come and share these slides themselves. So I'm going to do my best, but it's not going to be the same. But they essentially begin by saying like that providing financial assistance works, right? Statistically, it works. They tracked the system from 2017, really kind of going all the way up to where COVID began was kind of their endpoint, because you can see the last bullet point there was that they did indicate that once COVID became a factor, which none of us foresaw, obviously, and all of these other financial assistances came into place, and eviction moratoriums and things like that, it kind of skewed the results after that. And so they felt like they wanted to cut the study off there because there were other factors at play. But overall, very measurable decreased use of homeless services, decreased use of shelter entry, and that those results persist over time. So again, part of the reason why the study took so long is because they were basically waiting, right, to see are people coming back into services. Because it was one thing to say, yeah, we helped and they're not homeless now. And to say that after 90 days would have, it would be important, but not as important as this kind of long-term longitudinal results. So that's what you see here. And then kind of the statistical probability of the result of the household becoming homeless later, both in the treatment group and the control group later. Next slide, please. So just kind of some key takeaways to summarize. That the financial assistance definitely has an impact and decreases the likelihood of the households become or enter into shelter. And that also just homeless services in general decreases the utilization of services, and that those results sustain. And then Leo also did some pretty detailed work on like the cost savings. So they took a look at like how much does it cost to like house a household through like a rapid rehousing type intervention. A rapid rehousing would be like a 2-year rental subsidy along with services, which is a popular intervention for households that would be in the same kind of vulnerability thread, that if the household had already become homeless, that's what our system would respond with. They would find the family, subsidize their rent for 2 years, hopefully, decreasing the subsidy over time, and then have a case manager assigned to help in that family. So a pretty significant cost savings at that, 5,600 amount of financial assistance plus services. Yeah. Okay. Yeah, no problem. Sorry. Okay, can you hear me now? Is it better? Okay, cool. On the Zoom, yeah. Okay. Oh, yes. Okay, so just a little bit of I should have done housekeeping at the beginning. No, it's okay. I'm gonna go through kind of just our general deck, probably like 3/4 through already, just to give people kind of an expectation. And then we're going to hear from Jasmine, who's been a participant in the program and is now active in our homelessness prevention system advocacy committee, which is a committee that we have established of consumers of the system, of people who are either went through it in the past or are currently enrolled in the homelessness prevention system, because it has become a really critical and kind of primary component of Destination Home's work to view and kind of improve our systems through the experience of people who are going through the services. We call it lived experience. And so that's what you're going to hear. And then we'll have ample time at the end for any questions and answers. And from all three of us, we can answer questions, and happy to get into any more details that missed or repeat anything that wasn't heard. So just, thanks. Um, I think the final section is kind of where do we go from here, right? We've been operating, you can go to the next slide, please. So we've been operating the homelessness prevention system now for over 5 years, continue to expand from capacity standpoint, partner standpoint, learnings about what's most effective and how to intervene really efficiently. We're always looking to improve. I said one of the things where we're going from here is to kind of institutionalize the homelessness prevention system within the county's safety net response. That's one goal. But we also learned, some nuance or kind of deeper dive into what we learned from the LEO study, from the independent evaluation, was that they could very clearly state that homelessness prevention, the way that our system operates, works at the highest vulnerability levels. So families that are the most vulnerable, most on the brink of homelessness, this absolutely statistically works. And they were able to say that very discreetly. There's a category below the highest vulnerability where, of course, we're helping stabilize families, definitely works. But because we don't have a lot of, that percentage of households that's coming back into shelter, for example, is so low. We feel like there's more to learn about, like, who does this intervention need to be applied to, knowing that we have limited resource. So we took a deeper dive into LEO study data as well as our own system data, because we have years and years of people coming into Santa Clara County saying that they're homeless for the first time, taking an assessment and answering a lot of detailed information, and kind of comparing that to who we're seeing in our homelessness prevention system. And we saw some data-driven themes arise that we right now, like in 2022, October, are actively working with our system partners to say, what should we do about this? What strategies can we deploy to really kind of target these resources more? So we're seeing things like disabling condition, which can include a wide variety of categories, to be honest, which is part of what we're exploring. That can include like chronic health conditions, physical disabilities, mental health conditions, behavioral health conditions. So really trying to understand, like, where are people with disabling conditions falling into homelessness. A great example would be people going to our public hospital system, Valley Medical Center, for example, and even Stanford, since that's a little bit closer to where we are physically right now, and getting exited directly into homelessness. Like, how do we stop that, right? Seems like a no-brainer, but it's happening every day. And so that's the kind of type of intervention that we're talking about. Same thing with justice system involved, right? We know that over twice as likely that someone becomes homeless if their justice system involved, if they don't receive the homelessness prevention system intervention than if they do. So again, how can we work with the criminal justice system to make sure that people are not being exited directly from jail or prison into homelessness, right? Very easy. It seems easy place to capture people and prevent homelessness, but we're seeing that people are more often than not, that those connections are not being made. And then finally, overwhelmingly, we saw this in the LEO study data and our own system data, that a prior history of homelessness, so people saying, I was homeless in the past, I was housed, I'm trying to hang on, is also, actually statistically the largest indicator that someone really needs the prevention system. So then it's about, like, how can we use data and our system knowledge and all of our partners and we know where people are already been homeless. We have a whole database system that tells us the history of homelessness. How can we use that to actually, like, push people up to the front of the line, right? It's like, oh, you've been homeless before. We know from our research that you are more likely to become homeless if we don't intervene. We need to make sure that we get a hold of those people. So that's one of the elements of what we're going to do next. And the next slide, please. I think the other thing that really has become a theme as all of the COVID financial assistances have ended, the eviction moratoriums have ended, is that we're just seeing the needs skyrocket, right? The state emergency rental assistance program is over. Most of the local, COVID-related financial assistance programs are over. And you can see, like not surprisingly, right there, that's where we're seeing a spike in the need. We have a really great, relatively new partnership with the court, the unlawful detainer court system in Santa Clara County. We're seeing that spike as well. We're seeing UD filings spike. Luckily, we've been working in partnership with the court system and the landlord associations to be there. And we are having more and more opportunities to be involved in mediations where we can actually apply the financial assistance resources that we have if the tenant and the landlord are willing to kind of get together and mediate and come to an agreement and say, you know what, you owe $30,000 of back rent, but if you can pay that, like I'm willing to work with you. We are able to do that now. And that's been a big plus. I think the thing is, and the next slide kind of gets to this, is that we know, first of all, not all of our families that need assistance are ending up in UD court, right? There are lots of different situations that people are in as far as their housing arrangements, and whether it's formal, informal agreements, all different kind of scenarios. And we want to make sure that we're capturing all the households who need it, because this data is staggering, and why it's, we continue to need to expand the prevention system services and have services like HIF around, because 56% of the households are over 100% rent burden. How that doesn't even make mathematical sense, but we all know that it's true, right? We all know that people are just scrambling and putting all of their income toward rent. I don't know how people are doing, eating, etc. I mean, we can all imagine the sacrifices and things that people are making. So we're looking at this and knowing like we need to continue to expand. We need more partners so we have a wider breadth, but really we need more financial resources to be able to build the infrastructure and help more families. Our overall goal, next slide, please. I think that might be the last one. Yeah, okay. Our overall goal from a system perspective in Santa Clara County is to expand the network to be able to serve 2,500 households per year within 2 years. That's kind of like the goal that we have as a system. So I'm going to stop there. That's kind of like the nuts and bolts of how the system works and our impact and all the partners involved. But the other, as I mentioned, like the other critical component of this is the people that are that we're trying to help and are going through it. So super excited. We at Destination Home, around 2018, we established something called the Lived Experience Advisory Board. And this is a group of people who are all currently and formerly homeless. And we really started learning about and building what it's like to build power and really kind of shift and share power with people who have lived experience, who are experiencing homelessness, who have been the beneficiaries or the recipients of different housing services, et cetera, in our system. And then once we saw that kind of build momentum and really have some successes, we decided that it would be awesome to do something similar for homelessness prevention, right? So these are people who are currently housed or but have been able to engage with the homelessness prevention system. So it's relatively new, but we've done a lot of work. So Ingrid is going to tell us a little bit about the journey of how we got to where we are with that group now. And then Jasmine's going to tell us about her personal experience in the system, and then we'll answer questions about whatever, above all the above.
Hi. So my name is Ingrid Granados. I'm an initiatives officer. Can you all hear me as well? Okay. With Destination Home. I've been with Destination Home now for about 2.5 years. I have the honor of having started alongside the pandemic. So my experience actually comes from being a service provider with HPS at one of the service agencies previously. I also am a recipient, so I am part of HPS and those funds. One of my points of view is somebody who was worked in an industry that was not in the time that I was not able to have a livable wage and needed assistance that I was offering other people when I was in a transition state. So I have the honor of also being in the committee with Jasmine. So one of the things, so I say that now because I've been with Destination Home now, and I don't work on this initiative, but I know a lot about it. So you're welcome to ask me any questions as well from that perspective. And I'm really here to talk about what the advisory board is. The advisory board, as Chad mentioned, we lead with lived experience. As you just heard me speak, I'm a person with lived experience as well. We really believe that perspective is fundamental really to creating systems change, right? And to including those perspectives and to addressing really racial equity and structural inequities. So in that spirit, we do a lot of advisory boards. As you may hear right now, our advisory boards are pretty popular. About a year and a half ago, they started reaching out, surveying some of the participants that had received assistance. There was a lot of intentionality to, again, create a board or a planning committee that would help create this board. So we met for it was about 6 months of time. For me, it seemed like one continuous year and a half. So I had to check in. It was about 6 months that we met first with the planning process. So with Sacred Heart, and then as I mentioned, the other initiatives officer, they planned the planning group, right? To make sure that it was intentional and really bringing to light the experiences of people who have received it from different agencies as well. This was offered to recipients, and from that, it was about, I think, 7 to 9 of us who were the planning committee, really talking about who was going to be part of the group. If one of the things that we decided, for example, as a group was that the advisory committee could include people who were housing insecure, not just recipients of HPS, because as a group, one of the things that we discussed was the experiences that we had experienced were very similar to other people, and we really wanted their perspective as well. We just had the opportunity to be connected with the service, right? So maybe there was gaps in information that would be missing to figure out how others were able to survive those circumstances, even when they didn't have HPS. So that's one of the things that we discussed and we all agreed upon as a group in terms of who the members can be. We are now on that second phase. We are now officially an advisory board or advisory committee. And so it's the House HPS Advisory Committee. They're all very long names. Originally, we were the lived experience, housing prevention, or something like that. So what this board will do is really guide the policies. We look at all the questions that Sacred Heart has in terms of how the program is going to be implemented as well. And also really making sure, as Chad mentioned, this is going to be moving over to the county. This is going to be a program that is part of our system. So this group is really there as a checks and balances to make sure that we are keeping to the original intentions of this initiative, of this program, and that, oftentimes government doesn't have that perspective of lived experience. So really it's to constantly keep a reminder on that. We meet bi-monthly. So we meet about twice a month, and there is sometimes that we have breaks as well for a month. So for example, in December, we will be meeting with less frequency because of the holidays, but for the most part, it's a very consistent group, and we're facilitated by Sacred Heart as well. And now I'm going to give a little bit of time to Jasmine, and please continue to put any questions. I see the chat looks popular. So any questions about anything that any of us discuss, and then we're all going to have Q&A at the end of Jasmine's story to talk to us a little bit. And I'm going to be doing the translation for her. So when she has a pause in her thought or in her speech, then I'm going to be translating.
Buenas tardes. Mi nombre es Yasmín. Vivo en San José. Me voy a presentar rapidito. Tengo 3 hijas y la primera vez que nosotros supimos del programa de ayuda para la renta fue cuando nos enfermamos de COVID, mi esposo, mi niña, la más grande y yo. Y en ese entonces, pues nosotros no sabíamos mucho de recursos y hubo algunas barreras. La primera fue el idioma, otras que no todos los recursos se adaptaban a familias como nosotros, inmigrantes. Entonces, fue cuando encontramos el programa de Sacred Heart. Y
hello, my name is Jasmine. Let me take a second to introduce myself. I'm a member, I'm a community member. I live in the city of San Jose and I have 3 daughters. I was introduced to the program because somebody mentioned to me that that the program existed at Sacred Heart. I was in need of assistance when when COVID started because my husband and I had gotten COVID.
Ok, sí, gracias. Entonces, pues nuestra principal barrera o que nosotros pensábamos era, ¿verdad?, el idioma, sinceramente. Después de ahí no había muchos recursos que se adaptaran a nosotros. Encontramos el Sagrado Corazón, aplicamos para la ayuda de renta. De primero fue un poco difícil porque yo pienso que toda la gente estaba llamando para pedir asistencia, pero ya una vez que nos pudimos contactar con la persona indicada. La verdad fue de mucha ayuda. Sí piden algunos papeles que a veces uno a la mano no los tiene, pero de verdad es mucha la ayuda y principalmente en mi caso.
So one of the things that we experienced was that there was a lot of barriers to assistance. The biggest barrier that we faced at first was a language barrier. There wasn't programs that would be able to assist us in Spanish. Another barrier was that they're just families that weren't able to accommodate to our special circumstances in our family. So one of the so then I found Sacred Heart and I was able to connect with the assistants. With the assistants that they had, it was a little bit difficult at first in order to connect with them. There was, I'm assuming that a lot of people were needing assistance because of COVID, and the phone lines were actually really jammed and it was a little bit hard to get through.
Pero una vez que ya pudimos como contactarnos con la persona indicada, fue más fácil y el tiempo que recibí ayuda de verdad fue muy de mucho provecho para nosotros, ya que mi esposo normalmente es el único que trabaja. Somos una familia de 5, pero yo de verdad no puedo trabajar porque tengo una niña especial, entonces me demanda mucho tiempo estar en terapias, en citas, en todo eso. Entonces, para una sola persona es difícil.
Once I was able to get through, they were able to facilitate the assistance. There wasn't a lot of requirements in terms of paperwork or information that they needed. But the reason why we needed assistance is really that my husband is the primary income earner in the house. I really am unable to work because I have a child with special needs. So that requires me to be out with her often with special therapies, with her doctor's appointments and such. So we really needed the assistance because he was unable to work because he was sick.
Y pues sí, pues de mi casa les digo que mi esposo es el único que trabaja, entonces era un poco complicado y la manera que yo traté de ayudar es buscando los recursos. Encontré el Sagrado Corazón, nos ayudaron y pues aún así con esa ayuda a veces hay otras dificultades porque hay más necesidades de repente, no nada más en mi familia. Yo he visto muchos casos en San José, mucha gente que tiene muchas necesidades, pero a veces no conectan con los recursos que deben de ser.
So for myself, we really did need the assistance because my husband was not able to work during that time. But aside from the assistance, one of the things that we had were a lot of other needs. Voy a interpretar un poquito. I just wanted to confirm because I wanted to be accurate in my translation and I'm being interpretive. What she means is case management. There was a lot of needs in terms of outside of monetary ways, other case management needs that not only her family, but that she has noticed that other community members need as well. So one of the things that they really assisted with was being able to connect other resources, not just the financial assistance. So what she was saying is that they were very helpful in that. Sacred Heart and her worker was really helpful with that.
Pues sí, nosotros, gracias a Dios, estamos estables en nuestra casa. Esa ayuda de los 3 meses que nos dio el Sagrado Corazón fue de mucho, de verdad pudimos estabilizarnos. Pero sí es muy importante, o sea, voy a hablar por mí, pero también por todas las familias. Yo veo que hay muchas familias que no tienen la posibilidad de conectar recursos y hay muchas familias enteras que, digamos, una familia de 5 o más están en las calles durmiendo en sus carros, porque de verdad ahorita está muy difícil. Mucha gente no tiene la misma oportunidad de trabajo.
One of the things she mentioned actually previously that I didn't say was that she was very fortunate to be able to be connected with those case management resources, but there is lots of community members who do not have access to those resources that would have also been helpful. So one thing that she was saying is that they are now stably housed. They were received assistance for 3 months and they have been able to maintain their living and have been maintained stably housed since then, but that there is a lot of community members out there who, one, do not know about these resources. And when they do know about the resources, they're not able to be connected to them. In particular, she's talking about families who are currently out in the street. Well, she wants people to know that there are families who are living, whether it's in their car or directly out in the streets, that could have really used assistance and that could use assistance not only monetarily, but also with the other resources that were offered.
Sí, pues sí, obviamente lo monetario creo que es lo principal, ¿verdad? Pero yo creo que todos los recursos, la salud mental, todo tipo de recursos que ayuden a las personas también a sobrellevar los que sí perdieron su casa o las personas que están afuera, que haya alguien que los apoye. Entonces es muy importante que haya ese tipo de recursos donde ellos puedan hablar y sentirse identificados o que alguien los escuche y que importan.
Yes, as I mentioned, that all those resources are really important. What she mentioned as well is that, you know, not only for her family of 5, but she's speaking on behalf of the community, that there is a lot of need for not while monetary expenses and help is the primary importance, psychological help, mental health, for example, resources with education, all those other supplemental things are also really important for those people who are housed and who are unhoused. People need to connect those things with the community. Okay, and that's all. And that's all she was mentioning about just needing to connect people with resources so that they can remain stably housed. ¿Quiere platicar un poco?
Bueno, yo inicié en este grupo. Primero formé parte de otro que era por medio del Sagrado Corazón igual. Y ya después me invitaron a este otro grupo y ahí he estado a gusto y me he dado cuenta que hay muchas necesidades realmente. Y este grupo se enfoca en apoyar a las personas, a conectarlos con los recursos y también algo que es muy importante que nosotros estábamos pensando que las personas que formen parte del grupo o del comité sean de en cierta manera alguna persona que por alguna situación ha pasado algo similar, porque cuando las personas
Está bien. One other thing she mentioned earlier was that sometimes people just need to be heard. So even with the assistance, it's just really important to have somebody who is culturally competent, or she said somebody que le entienda uno, and that's able to hear you. What she mentioned, the reason why she joined this group, she previously had joined another committee or another organizing group with other parents at Sacred Heart, and then she was told about this group. She has felt really comfortable. She has felt very empowered and that her voice is being heard. One of the things that she wanted to say was she said she's felt very comfortable, and that as a group, she also mentioned that was really important. What I mentioned earlier about we felt that it was important to bring in the voice of people who have had the same experience of being housing insecure or having this financial difficulty, even if they did not receive assistance through the program. Because
sí. Y pues es importante que también más personas conozcan del grupo y también que sepan, pues, que se ocupan más recursos. ¿Es la palabra? Sí, recursos financieros para ayudar a más personas que como yo, pues en algún momento lo pueden necesitar y que sepan que este tipo de grupos están para eso, para conectar a las personas con la agencia o con la organización indicada.
She's was saying that it's really important for more community members, for people to know about groups like this, so that you know that there is an effort being done and that that resources are needed, financial resources, for example, are really needed to help more families like hers and other families that are not connected and do not know about this. So that this help is really valuable and that this needs to continue. So it's really important for people as well to know that these advisory committees exist.
Bueno, pues era todo lo que yo les quería decir. Gracias.
And that's all she wanted to say. Thank you. And we are open, I think, for questions for any of us. Yes, you can please chat in your questions. I'm assuming you can also raise your hand. It looks like we have monitors on the Zoom, so they will be able to. But the chat is also is better received. Anybody from the room as well? Yeah. System. Mm-hmm.
I think a couple things that didn't necessarily come out in the presentation that have been really critical for how we have operated the program. So we have 19 partners, which is probably obviously hard to wrangle. We have one partner, Sacred Heart Community Service, who is both what I call a direct service provider. So they're meeting with families and providing services. They also provide a function that we've come to call network coordination. So it's actually a separate, it used to be all the same team when we were small and getting started, but now it's actually a separate team within Sacred Heart. And they kind of umbrella coordinate all of the partners, all 19 partners, including themselves as a provider. So what that has allowed us to do is have like a centralized resource and expert for best practices, trainings, data collection and analysis, quality improvement. Oh, this organization's getting a little out of whack. Let's go check on, what's going on over there. Managing this like flow of 1,600 new households a year and like which organization works with which, you have people walking in the front door of like a Sunnyvale community service, and they're a Sunnyvale resident. That makes sense for them to stay there. But then you have people calling on the phone and kind of triaging like, okay, do you have a preferred partner? No. Okay, this is the one that has capacity and space. So all of that kind of coordination. And that's been like a really critical piece. And it seems like there's a lot of components, right? You have all of our funders, then you have Destination Home, kind of receiving funding from various sources, and then kind of going out and giving one single large agreement out to Sacred Heart. And then they in turn have agreements with their 19 partners. But each, I call it an accordion sometimes, each kind of step in that process, we all have our own roles and functions, and we've really like played to our strengths and also alleviated, for example, a Sacred Heart from having to worry about all the different funding sources, right? Like, so we worry about that and we do all the billing, et cetera. And they turn around and their primary job is to make sure that they implement the program. So that is part of how we have like again, like it's theoretically a uniform process no matter which of the 19 doors you come in, right? But that's like a constant process of kind of making sure that everyone's trained and that everybody is having. But that's the goal, is that literally anyone can go to any place in the county, no matter where you are. The example that I always use is like, what if you work in Palo Alto, but you live in San Jose? Like, you want to be able to go to the opportunity center on your lunch break, right? You don't want to have to like wait until you can take a day off and go somewhere in San Jose. So that's kind of the functional of that. But it's also how we make sure that like that person, who, no matter which place they end up at, is going to get the same type of experience, the same level of resources, right? It's like, oh, like in Palo Alto they have more money, and like, no, like everyone, no matter where you go, gets the same experience, the same resources, the same access to services, et cetera. And so that's part of how I think we've been able to kind of wrap around, because then also you have like the bird's eye view, like, oh, this family actually could use the specialized services of like a BOC, which is like a healthcare provider, right? Like if they have like a high intensive chronic health condition, maybe they get shifted over to one of our providers who has that kind of expertise. So I think that's how we're able to wrap around and stay connected so well. You asked another question that I was gonna ask, but I forget. Okay.
I'm gonna quickly add as well that so the providers meet monthly as well. So a lot of this coordination happens like actually being able to communicate with each other, and then there's a really open communication that Sacred Heart coordinates. So that's often how the wraparound services get done. It's not by just one agency. Oh, sorry.
So like the holistic approach that you have to look at the whole person and the what they need, and it's not just a certain dollar amount, it's based on their experience and what they've gone through. How much of that, and it might be a percentage, but I kind of would like you to dive a little bit into like is that data driven, or is that like the human element? And if so, I'd love to hear about the data, because I think the human element, what she just talked about, was phenomenal. But I don't know if there's a certain percentage and breakdown, if that makes sense.
mean, I would say it's largely based on the human element, meaning we really do have a model where it's like once the household is assessed and deemed eligible, right? Then it's just like, let's just figure out what is your unique situation and how do we address it. And like I said, that it's 99% of the time there's some kind of immediate financial need. And so we actually have like an internal operational metric based on like how quickly we can get that assistance out, because we don't want the system to be contributing to further hardship, like a 3-day notice that we didn't get a check out for 2 weeks and the landlord's like, I can't wait any longer, right? So like there is like some performance based mechanisms to make sure that we're getting the money out efficiently. But then it's just really like, okay, it looks like not only can you not make it this month, but you're probably not going to be able to make it next month because you're not working right now. So, okay, let's figure out like, how do we get you back working, or what's realistic? Like, who are the potential income earners in the household? So it's very much based on that individual household need. But then I would say from a data perspective, bearing that out over, we'll be tipping into over 5,000 households here pretty soon. You start to kind of see some trends, right, about the needs and what that looks like. And what we're seeing is like, and it was kind of on that bar chart, but like the 70% kind of falling into the $2,000 to $6,000 range, right? Where like, and that's usually, I would say like an average from what I can tell or what I can see, is because we see a lot of the specific cases over the years. A lot of times it's like maybe 1.5 rent, 1.5 months worth of rent initially, and then kind of a tapering down partial rent going forward. And then a lot of access to resources, as Jasmine mentioned, like, because we're getting a lot of households. This is something that we learned, like, these are households who are not familiar with the homeless system of care. They may never have, like, they don't even consider themselves on the brink of homelessness. That's not even like you're a household, you're struggling to pay rent. That's not what's on your mind. So you're not connected to the safety net system. And so a lot of it's kind of discovering new resources and making sure people do have access to like food stamps if they're eligible, or cash aid, or childcare subsidies, and these types of things. And that's a big part of the work. I would say the other statistics. So we do have a small slice of households who, as I mentioned, we've had households. I would say these are outliers, right? 80-year-old single adult with cancer, right? No matter what we do, we're not going to be able to get this person back to work. Like they're on a fixed income. They're in an affordable income based apartment already. Like the best thing we can do is continue to provide like what essentially amounts to like a shallow subsidy, $200 a month, and that family can survive, right? And like we know, I mean, unfortunately, like they're terminally ill as well, right? So it's like we know that it's not going to be forever. So what we start to see is like the data shows us that like that the overwhelming majority are these cases where it's like $5,600 on average, 3 to 6 months on average. We're seeing that most households are fighting just as hard as we are to get back on their feet. Like they don't want to, they're not like, oh, thank God, now I have like a free ride for the next 2 years. Like that is not that's not the take that people are like, oh, do I really need assistance next month? And sometimes we're like, yeah, like maybe 1 more month will help you get you on your feet. We try to come up with plans in 3-month increments to kind of take the stress off of like not having families have, like, it's really hard to say, hey, go, like, let's work on getting you a more affordable apartment or getting you a job when you're like, I don't even know how I'm going to pay rent 3 weeks from now, right? So we try to alleviate that a little bit and kind of program in like 3 months at a time. But again, we're seeing 3 to 6 months and on average $5,600 spread over that 3 to 6 months. I mean, probably 4,000 of the households are that scenario. And then the outliers is where we're really trying to build out these longer term solutions. So Destination Home is piloting a guaranteed income pilot for households, because we feel like that there's a slice of the data, so to speak, of the households where really it's just not penciling out for people. Like they're not affording to live in this area, and they need some kind of like we're doing $1,000 a month for 2 years, and we're going to kind of study that. We're working with the UCSF Benioff Center on that research study. And then we think that there's other, I guess, specialized categories like seniors or households who have like really chronic mental health or physical health conditions to where like their income earning potential is very limited. And we're trying to kind of work with the supportive housing system and other safety net providers to come up with like additional supports for those households, because that's where this model kind of has its limitations, right? And it's like the end of the road. So hopefully that answer gave a little more color.
One more question. So we actually use, we were using something called the previous BDAT previously. And now we currently use a new assessment called the HPAT. It's a smaller assessment. It's supposed to be less traumatizing as well on people. There's a lot of intentionality about also changing the necessary answers to figure out people's vulnerability. But it's very similar in terms of the scoring model where, you know, you will get placed into a range. You make over a certain score, then you would be eligible. And your score is valid for a year, very similar to the VSBDAT. It does, yeah. All of the information, which is very similar, is still in HMIS, which is the Homeless Management Information System, oftentimes known as Clarity, or because that's the program that it runs on. So some people call it Clarity. Yeah.
And I don't know about you all, but we took a few. We made a few modifications during COVID that we probably wouldn't have gotten away with if it wasn't COVID. And one of them was, you know, we were like, this 36 question assessment is too much, you know, and we had a lot of data. So we actually asked Leo to help us, like from a data science standpoint. And we said, what are our options for shortening this? And they came back and said, basically, like, you could ask these 9 questions and you would get essentially the same result with a little more margin for error, right? Because you're not asking as many questions. And we're like, oh, that sounds amazing, because it cut it from like 40 minutes down to 10. And then I would say like another, I'm glad you brought that up about the sensitivity of the questions. Like maybe our first foray into like asking people who were in the program, like for valuable information or input or decision making was, we basically said like, well, we were learning that some of the questions were invasive, right? Like we're like meeting people for the very first time. These are people who are not like, you know, tried and true, you know, safety net benefits people. This is like them seeking assistance maybe for the first time in their life. And we're asking like very uncomfortable questions that any of us would not want to answer from a stranger either. And so we got really great input on like which questions were like uncomfortable and what are some other ways that we could ask those. And we just made the changes based on that input. So that's like a good use of, that was like I think a very tangible purpose of partnering with people who've been through the program.
Oh, sorry, in English. I was going to tell them in Spanish. You would have one question for Jasmine if she feels comfortable answering. And she's answered us a little bit while she was speaking. But I was wondering about the key things in the months. That her and her family needed to go from point A to point B to become stably housed. Okay, so what were the key things that she needed in order to remain stably housed? And how many months? What did that include? Él le quería preguntar.
Bueno, la asistencia monetaria de la renta fue por 3 meses y con ese tiempo que ahorramos nosotros dinero que no pagamos renta, que nos ayudaron, pues con eso pudimos estabilizarnos los demás meses, pues para comprar nuestra comida, pagar las otras cosas que teníamos. Fue de gran ayuda esos 3 meses que nos ayudaron. Con eso pudimos solventar probablemente otros 2 meses en lo que nos pusimos. Mi esposo regresó bien.
So they assisted us for 3 months. In the 3 months that they were assisting us, any income that we had, we saved. We saved in order to use that for the next few months while my husband's income was reestablishing or increasing again. So it took it. So once he returned to work, it still took him some time for his income to come back up to normal. Let me ask a follow-up. ¿Habían otros servicios que también ofrecieron como comida, educación, cosas que no eran de la renta?
Pues no más, no solo.
In her situation, she didn't need any other assistance. So for example, I asked if she needed like food stamps, for example, or other situations. I can tell you from having done the case management though, that there are agencies, for example, that can apply for food stamps. They have partnerships with CalFresh. So if a person is in need of that, at the time, one of the partner agencies that was one of the 70 was also giving out food boxes during COVID. So any participant that could qualify for that was also, especially in those zip codes that he's mentioned, they were delivering food boxes for that. So many participants received food as well. There's uplift passes for those people who need transportation passes as well. Some of the agencies can uplift passes are basically transportation. So like bus passes. All those are managed through HMIS and our coordinated entry as well. So you basically connect them with the agency that has those needs. Yeah. Oh wow. Okay. 30 seconds for each of my S. No. So really quickly, and I'm going to just break it down very realistically. In order for HUD to give you money, every jurisdiction in this country has to have a way in which they are managing their continuum of care. That means that all the people working together to end homelessness and to get grants from the federal government. So our continuum of care is called OSH, the Office of Supportive Housing here. The method or the program that we chose to manage the system or the information is called Clarity. That runs, so everyone has an homeless in management information system. It can be run on a variety of programs. All is called Clarity. What it does is keep data. It keeps data on the people who have been homeless, who are chronically homeless, the programs that we use, all the money that we have. If you are part of a continuum of care, so if you have money from OSH or you're giving money away somehow, sometimes there's special arrangements made with different agencies so that we can see service transactions. Then we have a better idea of how all the partners are working together in order for us to see what services are being provided. And as we say, if it's not an HMIS, it doesn't exist because there's no way for the rest of us to know what's going on and the help you received unless it's put in there. Anything else you want to add about that? So we need it. We need it. We love it. No, people don't love it, but we want them to love it so that we're all on the same page. And when I say people, I mean the entire country who uses it. So, not just, it's not a personal thing. It's just it's a really big information data bank pretty much. And some jurisdictions look different. So, and we are, just so you all know, OSH in general, with our COC is looking at different ways to collect data and different ways to see people's vulnerability indexes as well. But every jurisdiction is able to figure that out on their own and have their own HMIS. So, you're welcome.
Yeah. For this program or in general?
So really quickly, where does Destination Home get their money? Because it is unique.
Yeah. So prior to 2018, we were much smaller. It was mostly Jennifer Loving, our CEO, and then a couple of us kind of program officers, basically. And we would do, like, we started the homelessness prevention system with about $750,000 of foundation money, basically from like Packard Foundation, Sunlight Giving. So we have like some kind of legacy foundation funders that we've been working with for a long time. Sobrato Foundation. And then we work with like what we call our system partners. So that's like County of Santa Clara, Safety Net, City of San Jose Housing Department, Housing Authority, right? That's kind of like the core governmental, mostly public sector system partners. And they have various funding sources. So we really try to put those two funding sources together. I think what changed is in 2018, we were very fortunate to receive a 5-year, $50 million commitment from Cisco, so corporate funded. And then later that year, the following year, a match from Apple. So we have $100 million over 5-year commitment from those two corporations that really shifted our organization into a whole new realm, and that we were no longer, we're still totally ingrained with the system partners, opportunistic, but we literally could not do initiatives on our own without them being aligned and supportive. And now we continue to do initiatives in coordination with our system partners, but we also do things on our own because we have our own private funding. Then we kind of have built that pot of funds with we work with Stanford Healthcare as well, and private donors, to where we're able to do things like the guaranteed income pilot, where we don't have any government funding involved in that, and we're able to initiate on our own and say, this is really important to us. We feel like it's aligned with our community's community plan to end homelessness, and we want to kick this off the ground with our own private funds and then institutionalize it later. So that's how.
Thank you.